In May of this year, Colorado became the first state to effectively ban anonymous gamete donation. We're talking about using eggs and sperm donation to help somebody else conceive a child. Starting in 2025, donors have to agree to allow their identity to be released to those donor-conceived children when the child turns 18. The law requires fertility clinics to request updated contact info and medical history from donors every 3 years. 9 Health expert Dr. Payal Kohli joins us now to talk about this law, which we should mention off the top was a bit controversial, in part because, among other reasons, it followed a really big fertility fraud case here in Colorado. There was a doctor in Grand Junction who was treating women and was using his own sperm as a donation, and these families didn't know it. We covered this case extensively, but that's not the only reason. There's medical stories behind the choice to pass this law as well. So, Dr. Kohli, maybe catch us up. What's changing here for this?
Yeah, that's exactly right. I think one of the things is that we've really made a lot of advances in genetic testing now, and what we call direct-to-consumer genetic testing. Most of us, if we want, can write into a website, send our saliva sample, and actually get a profile of our genetics that can tell us our ancestry, and then use social media almost in a way to figure out who our, donated sperm or egg came from. So because of that, a lot of people were already doing this. The medical system really sort of said it's time to start legalizing this information. The second piece of it came from advocacy groups. So many of the kids that are conceived from donor sperm or egg really kind of got together and said, this isn't fair to us. We don't have medical information on our history. We don't have demographic information on who our parents are. And there have been cases, in addition to the one that you mentioned, where the parent might have had a significant mental health complication that could have been avoided in the child had they had that information. So that's what's really led to this change and lifting the secrecy around this.
I'm curious how this anonymity is going to, or the lack thereof, affect people who want to donate. When you look at the main reason why people donate, it can be lucrative, right? You can make money doing this, and if that's the only intent here, you're helping families, but are people gonna be so willing now?
Such a great point you're making, Alex. And it's not just the fact that it's lucrative, it's the fact that maybe you want to help somebody anonymously. Maybe it's not something you want to share with your family. So I do think that the pool of donor egg and sperm that we're going to get is going to be dramatically different as a result. And I think Colorado is leading the charge, but I do think this is something many other states are going to adopt. It may even become federal regulation with the way that things are headed. So anonymous donation or secret donation, I think, is really a thing of the past that we're not going to see anymore. And I think that may discourage some people from donating. It may also encourage more people to find out who their donors were, more kids to find out, and that could translate into impacts on their psychological and physical health as well.
Well, and on that note, I'm curious what some of the consequences might be for these families who are going to have to go through this way now.
Yeah, so it's interesting. The law actually, as we talked about, you have to know who the donor is. You have to know their history. Otherwise, they can't be a donor. They have to update that information every 3 years. So you have to be able to get in touch with them. If there is a fertility clinic outside of Colorado that somebody who lives in Colorado might be thinking about using, that clinic has to follow these laws. So they have to reveal the identity of the donors. Otherwise, the Colorado resident couldn't use them.
So the patient in Colorado means that the law will follow the Colorado law, not the donor state.
That's exactly
the bank state.
Yes. So if someone here in Colorado wanted a donor sperm from California, that California fertility clinic would have to follow our Colorado laws because the patient is in Colorado. And there's also stipulation in this law as well that one donor sperm cannot go to more than 25 families. So the idea of hundreds and hundreds of families coming out of one or a few donations from the same individual, that is being capped here in Colorado as well. So lots of implications.
And then those people conceived through that donor sperm or egg, then all living in the same community and potentially running into each other.
That's right. That's right. Exactly.
That was a big concern of families when they were talking about this law. So, Dr. Kohli, there's a lot to talk about. We also have quite a bit more on this topic on our website because of so much of the coverage of the Grand Junction case. So I would encourage people to check that out as well. Thank you.